COPD is certainly one of the most frequent chronic conditions worldwide. It ranks among the third most leading causes of death across Western countries. And unfortunately, the same applies to Austria. About 5 to 7% of the population is suffering from COPD. We do estimate that about 20 to 30% of patients with advanced COPD do have emphysema, and we have now novel treatment options to offer to these patients that improve their quality of life, their exercise capacity, as well as overall clinical condition and lung function. We have had now experience for more than 8 years to be offering treatments such as bronchoscopic valve placement in patients with severe emphysema that has significantly contributed to improvements in quality of life, exercise capacity, as well as lung function. And therefore, we have another tool that we can offer to patients in addition to medication and rehab that certainly has helped to improve the medical management in these patients. The valves are one-way valves that are implanted into the airways, leading to severely hyperinflated areas of the lung that are affected by emphysema. And the intention is to block ventilation to those hyperinflated and severely diseased and compromised areas of the lung, but allowing expiration. There is substantial clinical evidence stemming from a number of randomized controlled clinical trials that have contributed to the development of endobronchial valve treatment, and it is therefore now considered a sort of important part of the overall management in patients with COPD, backed up by evidence grade A level. So my advice to GPs as well as pulmonary physicians really is, please consider that there are add-on treatment options using a minimal invasive approach in patients with moderate to severely impaired COPD that are still symptomatic despite optimized medical management, such as inhaler treatment, pharmacological management, and or oxygen treatment, because we do have treatment options for patients with emphysema in particular that have been very helpful and are also backed up by good clinical scientific evidence.